As a surgeon, I get asked all the time, what do you do at work? Do you just operate every day? Well, let me take you through a normal working week, which for me starts on a Monday at 8 o'clock, and the week kicks off with a multidisciplinary team meeting, which is a meeting where we discuss all patients who come through the unit, and here we will discuss a treatment plan for them. The meeting can last anything between 2.5 or 3 hours sometimes, and for me the rest of the Monday is filled with admin work, and this can involve things like checking pathology results, checking scan results, planning theatre lists, and of course checking emails. And so yeah, as surgeons we still have to do admin work, which may not be the most exciting part of your job, but it still needs to be done. So I'm driving now to a separate hospital where I have an evening clinic. It's going to take me about just under an hour to drive there. I am about to start my evening clinic, and it's a clinic where it's a one-stop breast clinic really, where I see patients who have been referred from their GPs, come with breast symptoms, breast problems, and I will see them in this clinic. If there's anything that we need to image, they'll either have a mammogram or an ultrasound scan or both. If they need a biopsy, then they'll do the biopsy at the same time, then they'll come back to see me and we discuss their results. So another day today, and it's another busy one. I've got 2 clinics back to back, and it's a mixture of face-to-face consultations as well as telephone consultations. The telephone consultations actually stemmed from the pandemic. Obviously, we see more people face-to-face as the restrictions have been lifted, but the practice of doing telephone consultations is still happening, and actually it works really well. And I think for certainly for some patients it's more beneficial. They don't actually need to come to hospital for us to do the consultation. So yeah, so that's what I'm doing today, and now let's just drive to work. So it's the end of the day. It's nearly 5 o'clock, and I've just finished my double clinic day. Yeah, it's been quite hectic. I saw about 10 patients face-to-face in the morning, and I called roughly the same number of patients in the afternoon. Clinics are essentially a mixture of post-op patients, so those patients who've had surgery, and I see them or either call them to give them their results of the surgery. There are also consultations about planning surgery, so if they've been given a diagnosis of cancer, these clinics are the place where we talk about what is planned, what is best planned for them. These clinics are also where I break bad news, unfortunately. So if somebody has come to the one-stop breast clinic, say a week ago, and they've had a biopsy, then today is the day where I either give them the good news, in other words, it's not cancer, or the bad news, which is when I have to say to them that unfortunately they have cancer. So it's a pretty diverse and a mixed bag of a clinic. You know, it's a very interesting clinic because you don't know what you're going to have to do between one patient to the next. You do know your patients though, so you know roughly why I'm calling them or I'm seeing them, but it can be quite varied. So there is nothing like the first sip of coffee in the morning to wake you up. Oh, it's just so good. Today is Thursday, so I'm up again bright and early. It's a long day, it's all day operating list. I think may have about 4 or 5 patients. So I'm gonna get into the car, drive to work, change into scrubs, see the patients first thing. That's the time when we would go through the notes, go through the consent process again, make sure that they understand what patients are going to have. They are still agreeable to have them done. Mark up the patients, that's very important. And also mark the side of the patient, because if you have 2 of anything, you need to mark the correct side. The team had a mid-morning slump, so I just had to go and get some treats. So we're halfway through the day and it's lunchtime. Bit late lunch because it's just before 2 o'clock, and so far the day has gone really well. We've operated on 2 patients so far. They were quite big surgeries. We had to do a mastectomy for a pretty large cancer, and
We also had to remove all of the glands from the armpits because they had cancer cells within them. So that's one case. And the second case, we had to do 2 operations on that same person because unfortunately she had cancer in both of her breasts. So one side we could feel the lump, so we just removed the lump without any localizations. We didn't have to put a wire in. We also removed a few of the glands from the armpit. And the second operation on the other side, the other breast, she had an area of what we call microcalcification, which was proven to be non-invasive cancer, but because we can't feel it, she had to have a wire put into the area where the cancer is. This was done in the morning under mammographic guidance, and then she came up here and we removed that cancer as well. Quick break for lunch, and then we'll set up for the second part of the day.
So I'm actually off work today, which is quite rare, having a day off in the middle of the week. And I always take these opportunities to do other things. Obviously, I had a quick swim in the morning, which is obviously very, very important to be able to do and keep healthy. When you're working a full-time job and you normally start really early, and it's really difficult to get or find that time before work to do any exercise. You can, of course, but for me, it would mean that doing exercise at, 6:15 or something, or 6 o'clock even, which is really, really too early. So I managed to get a swim in this morning, which is fantastic. And then I've just finished recording a podcast. I was a guest on a podcast, and in that podcast, we were talking all about food, nutrition, and breast cancer, and how they're interconnected and related. So that was really, really fun, and really, really, useful thing to do, because of course spreading awareness about breast cancer and health is very important for me. So what I'm going to do next is I'm going to check on my emails, because I've got a lot of emails to go through. So it's the afternoon and just had lunch, late afternoon really, and I'm just catching up with a little bit more work. Some of you may know I also have a podcast called My Breast, My Health, and I am planning the next season, which is season 3, and I'm trying to get some content planned, interviews booked, scripts written for me to eventually launch season 3, and I'm hoping to do that imminently. So if you haven't checked out the previous 2 seasons, do check it out, mybreastmyhealth.com/podcast, or go to any podcasting app and search for My Breast, My Health, and you should find it there. So yeah, I'm just going to carry on with a bit more work with my trusted cup of tea. So earlier today, around lunchtime, Buckingham Palace released a statement stating that their medical team were concerned about Queen Elizabeth's health. And not long after 6 o'clock today, we learnt that the longest reigning monarch of Britain, Queen Elizabeth II, has died at the age of 96. And it's a really sad day for lots of people. She's been the Queen for 70 years, and it's a very, very long time. She's definitely, been present in my lifetime as long as I've been living, and that will be true for many, many people, not only in the UK but also around the world. And whatever your opinions are regarding the royal family or the monarchy, I would still suggest that it's a very sad day for many of us. So I just finished my one-stop breast clinic today, the end of the week, and it was quite busy actually. I had quite a few new patients to see, and they're patients who come with a breast problem, usually referred by their GPs. So the breast clinic is what we call a one-stop breast clinic, where patients will be seen by myself, and then they get examined by myself, and then they will get scans if they need them, and then they'll come back to see me straight away. If they are all fine, then that's good. They can
go home. Sometimes we have to do biopsies, which is a needle test, and if that's the case, then I will see them the following week. I also saw a few patients who I've operated on before, so these are post-op patients, and I had to give them the results of the surgery, and depending on those results, they go to see another colleague of mine who is an oncologist. So that's another cancer doctor who doesn't operate, but they would give further drugs like chemotherapy or other tablets, and sometimes radiotherapy. And there's another section of people who I see as a routine follow-up. So these are patients who have had their treatment perhaps a year or 2 years before, and they come to see me as a routine follow-up. And yeah, I hope this has been a useful, look into what happens in a week. It's quite varied, and lots of different things that we do as surgeons. So we don't only operate, as you can tell. We also do lots of clinics and lots of admin work as well. So let me know if you have any questions in the comment section. Let me know if you want me to do any more of these. Leave any comments down below, and it would be great to connect. Okay, take care.